Hi friends, if your NEET PG results didn't meet your expectations, or you feel you are underprepared and you're planning to give another attempt, this video is for you. In this video, I'll share a simple plan that can help you achieve a good rank. So welcome to another video. I'm Dr. Mankirat. I've done my radiology from Maulana Azad Medical College. So let's get started. So let us assume there are no postponements and exam happens in March 2025. So we have 7 months left for the preparation, right? So we'll divide these 7 months into 5 months and 2 months. So in 5 months what we'll do is we'll do primary reading. That means we'll read all 19 subjects, and in remaining 2 months we will revise whatever we have read. But if at all there is any postponement, whatever extra time you get is a bonus, okay? But for the time being, let us assume we have only 7 months. So let us come to our 5 months primary reading plan. So in these 5 months, we are going to focus on these four basic pillars. Okay, so what are these four basic pillars? The pillar number one is theory. So you read theory, you build concepts. Okay, so you can read theory from your notes. So you can follow either pre-written notes or handwritten notes, and choice is completely yours. But remember, you have only 5 months. So if you are planning to make your own notes, make sure you complete this within 5 months. So 5 months is the deadline, right? So how to approach videos? So do I have to watch all the videos? Okay, so I don't recommend watching all the videos. You just read notes. Okay, so most of the things you'll understand. So whatever things you are not able to understand, then you go back and watch video. Okay, maybe at 1.5x or maybe 2x. Okay, so you don't have to watch all the videos because the time is limited. So here comes the role of 20th notebook. So whatever important things, whatever facts you come across, you feel you should revise close to exam, you should write all those facts in 20th notebook. Then coming to pillar number two. So pillar number two is solving MCQs. So solving MCQs is very important part of PG preparation. So try to get into habit of solving MCQs as early as possible in your preparation. So maybe you can start with you can even start doing 10 MCQs per day and slowly move on to 20 MCQs, 30 MCQs and so on. And you have to reach a target of at least doing 50 to 100 MCQs every day. So you'll learn some concepts from QBank as well, and whatever concepts you learn or any important facts you learn, so you put those also in your 20th notebook. Okay, so pillar number 3 is mock test. Okay, so how to approach mock test? So many people will say, okay, give mock test early in your preparation. So even before starting your preparation you have to give mock test. See, I think all of you have given the NEET PG exam and you know what is the pattern and you know where you stand, right? So there is no point giving mock exam right now. So right now if you'll go and give mock exam, so this is only going to demoralize you. Okay, so what I personally feel is you don't have to give any mock exam unless you have finished 10 subjects. Okay, so what strategy I will recommend is, so do at least cover at least 10 subjects. Okay, so maybe you can cover 5 major and 5 short subjects. So once you are done with 10 subjects, you have prepared 10 subjects, then you can go on and give a grand test. So rather I will suggest, instead of giving grand test, you should focus more on giving subject wise test. So when you have done 5 subjects, so whenever you finish a subject, so give a subject wise test. Okay, so in this way you give 5 subject wise tests here, and when you do 5 short subjects, again you give 5 subject wise tests. Okay, so once your 10 subjects are completed, then you move on and then you give a grand test. Okay, so then definitely you'll be able to solve many questions, and that will give you confidence that whatever you have read, now you're able to solve questions. And then again, you have finished 10 subjects now, then complete 5 subjects, 5 more subjects, give one grand test. Okay, now you have completed 15 subjects, then again finish remaining 4 subjects and give grand test. So in this way, in these 5 months you have given 3 grand tests and total 19 subject wise tests. And the fourth important pillar is images. So nowadays, the most of the questions, they are image based. So how to approach images? So see, if you are following any colored notes, they contain good number of images, and those images, they should be enough. But if you want to have an extra edge as far as images are concerned, so I'll say keep these three books always on your table, or a PDF of these 3 books in your iPad or in your laptop. Okay, so these 3 books are Robbins, Bailey and Harrison. Okay, so daily try to go through at least 15 to 20 images from each of these books. From now on, make a habit that daily you will see 15 to 20 images from this book and read whatever is written beneath those images. So just the images and whatever is written beneath those images. So believe me, this is definitely going to give you an extra edge. This will boost your information. This will boost your knowledge. So here I will see the images and I'll read the text which is written below those images. So I'll go through all the images, see the text, and maybe even you can read the summary boxes also. So again you'll read the image and see the text. So that's all. And in this way, by the end of 5 to 6 months, you'll be able to finish the images of these 3 books, and this is definitely going to help you in the exams. Time. Then coming on to the subject-wise time distribution. So in 5 months, you have approximately 150 days, and I have created this timeline. So you have to finish, these subjects in these many days. And one thing I want to stress here is that do not ignore basic subjects, because nowadays you will see those charts where you will see the questions are only coming from the medicine, surgery, obs-gynae, and less number of questions are coming from anatomy and physiology. That's true, but actually what is happening is they are integrating the subjects. Okay, so they will not directly ask anatomy, so they'll frame a question from, let's say, orthopedics, and they will integrate anatomy with orthopedics. Now, for example, let us see this question. This has been asked in recent Neet PG. So they have asked, a patient with nerve injury was unable to make O with the index finger and thumb. So that means this is OK sign. Okay, so which muscle is involved? So the rectifying is not going to help. Okay, so even if you know that the OK sign is seen in median nerve injury, that will not help you crack this question. Okay, so you have to have a thorough knowledge. You have to have a knowledge of basic anatomy to solve this question. You should know which all or the muscles which are supplied by the various nerves. So your basics should be clear. Okay, so that doesn't mean you can ignore anatomy, because if you just rectify that OK sign is seen in median nerve injury, that is not going to help you in exams. Okay, so everybody will mark, so everybody knows that OK sign is seen in median nerve injury. These kind of questions will differentiate that, these will help you get a better rank in the exam. So moral of the story is, do not ignore the basic subjects. So don't skip anatomy, physiology or biochemistry, because less number of questions are coming from there. So nowadays they will ask integrated questions. So they will test your knowledge of anatomy in your final year subjects. Okay, so do not ignore basic subjects. So by the end of 5 months, if you follow the timeline strictly and you base your preparation on these 4 pillars, so you should definitely be able to revise these things in remaining 2 months. And also by end of 5 months, now you have your 20th notebook also ready, apart from your 19 subjects. Then we come on to the revision plan. So revision plan, we have approximately 60 days, and we'll divide these 60 days into 40 days and 20 days. So in first 40 days, we'll do comprehensive subject wise revision of all the 19 subjects, and in second revision, we'll do a rapid review with intense MCQ practice. So let us discuss these one by one. So in first 40 days, you have to revise all the 19 subjects, and the distribution of the days I have given here. You can follow this. See, by this time you have given 3 to 4 mock exams. Okay, so you know what are your weak areas, what are your strong areas. So in this revision, you will focus on your weak subjects. You will give more time to your weak subjects, and you will give 2 mock tests. So one mock test you will give at day 20, and second mock test you will give at day 30. So in summary, you have to revise the highlighted notes. You have to revise all the high yield points, and now you have to increase your MCQ practice to around 150 to 200 MCQs per day, and of course you have to take 2 full length mock tests during these 40 days. Rough distribution I have given here. You can follow. So depending upon your strength and weakness, you can give extra time in the subjects you feel you are weak in. Okay, now in second revision, now this is going to be a very quick revision. Now you have to continue your MCQ practice. So you have approximately 20 days. Okay, so major subjects you will give 2 days to each subject, and for the remaining subject you have to give only a half day to 1 day. See, depending upon your own comfort level. Yes, and on day 10 you will give mock exam, and on final, just before final exam, last day you will also practice one more mock exam. And of course, in these last 20 days, the maximum focus has to be given on your 20th notebook. So revise all the important facts, keep practicing MCQs, keep giving mock tests, and I'm sure you will be ready for the final exam. And during revision, remember the time is limited. Okay, so you cannot give equal importance to all the subjects. You cannot give equal importance to all the topics. So by this time, you know your strength and weakness. You have to focus on the things you are weak at, and you have to focus on the subjects which are volatile as well as important. So for example, biochemistry, pharmacology. So these are the subjects which are volatile and they are important also. So you have to give more time to those subjects. So this is all. Thank you very much. I'll give a link of a PDF in description. So this is just a 2-page PDF. You can modify it if you want, and you can paste it in your room. So this will serve as a roadmap for your preparation for the next 6 to 7 months. So just remember, you have to focus only on the things you can control. Nobody in this world can predict the exam pattern or what are the questions going to be. So you just have to work hard, and also it is more important that you work hard in a right direction. So if you found this video useful, please click like button and don't forget to subscribe if you want more updates. And do let me know in comments if you want more videos on subject wise approach. All the best, we'll see you in the next video.